Hi, this is Ben from Train Yourself Fit, and this is video 3 on how to treat your own knee pain. In video 2 I discussed a condition called hyperlordosis and how this causes your knee pain. Now this is basically the opposite postural problem and the exercises you need to do to address what's actually now going to be a posterior pelvic tilt instead of an anterior pelvic tilt, which you will have if you've got a hyperlordosic posture. So, how do you end up having a posterior pelvic tilt? Just like in the last video, I pointed out that posture very much comes about due to your habitual behaviour, such as sitting too much. Whereas with hyperlordosis, if you think of a nice level pelvis like so, you end up having a short quadricep, rectus femoris, which is one of the hip flexors, which causes an anterior pelvic tilt. If you're someone that actually sits slouched a lot of the time, you're likely to have the completely opposite problem, which is where the pelvis is kept in a posterior pelvic tilt. Now what this is doing with regards to the muscles is this is actually causing the muscle that was getting short before, the rectus femoris and the quadriceps, to stay in the lengthened position, while the hamstring, which is responsible for flexing the leg at the knee and attaches onto the back of the pelvis here, is actually kept in a shortened state. So this time the hamstrings are going to be too short and tight, while the quadriceps are potentially too weak and too long most of the time, and this becomes a habitual length for them to be kept at, causing the pulling on the tendons in the knee again that are going to cause knee pain. So, how to check if you've got a posterior pelvic tilt, going back to our posture check that I did in the last video. This time, if you think about the cross being at the pelvis, it's going to be the opposite way. So what muscles that are actually going to be too tight are going to be from the back of your leg, your hamstrings, and in the front of your torso, your abdominal muscles, while the muscles that are too loose are actually going to be the fronts of your thighs and the muscles in your lower back. So with the postural check again, if you go up on your tiptoes to get your baseline for what a good posture should be, where the pelvis is kept nice and level, what a posterior pelvic tilt posture will look like. Potentially you might have some kyphosis in the upper back, which is basically where you have something of a hunch back. But even if you haven't got that, all you will have, it says the pelvis is in a posterior pelvic tilt, you're going to end up looking like this, which is creating too much of a flattened lower back. Now what you should feel as well is that your abdominal muscles are very tight there, and you've probably got tightness, especially here just underneath your glutes. Now how to address this? Just like last time, we stretched the tight muscles and strengthened the lengthened weakened muscles, exactly the same thing. So here's some exercises to do just that. What you're looking for first then, with regards to the knee especially, is to stretch and reteach that hamstring to go back to its normal length. So what you want to do to stretch your hamstrings, here's one alternative. Lying down on your back, bend your knees like you would to do a sit-up. Lift one leg, which is the leg you're going to be stretching the hamstrings, the muscle in the back for. Hold just underneath the knee on the back of your leg and pull your knee in towards your chest until you feel a stretch in that hamstring. When you're in a position where you can feel a nice stretch but you don't want to go to a point of strain, hold that position for 30 to 60 seconds. Alternatively, if you can't straighten your knee like I'm not here, if you want to keep your leg nice and straight and just pull your toes of your foot back towards you, that will also create a real stretch in the hamstring. And again, you can pull the knee back, which for me here is about the hamstring stretch, but you don't want any sort of wobbling in the knee because you've gone too far. Alternative stretch for the hamstrings, it's just a pike stretch seated on the floor. This time, actually focus on pushing your chest forwards and looking up slightly, so you've got an arch in your back. That's actually going to cause an anterior pelvic tilt in itself, and that should create quite a stretch in your hamstrings. Keeping your feet upright, toes pointing at the ceiling and your feet together. Also, to increase the stretch, just pull your toes back towards you, and this should straight away be giving you a real stretch in the back of your thighs. Potentially as well an easier position to hold the stretch for longer, so this is generally a good stretch if you don't enjoy the one on your back. Increase the stretch even further, just by going forwards, but never go to a point where you're sort of really rounding your back like so. All the time you want to be keeping that arch in the back. Now the other area you want to stretch, like stated, is your abdominals are going to be tight, so stretch those. As in my mobility video, all you're doing is a cobra stretch. So hands on the floor, legs behind you, straighten the legs out, then looking up, pushing with your arms as you pull your shoulder blades together. You want to try and look behind you. I know that's impossible, but it's a good prompt to get a good arch in your back. And you should feel a nice stretch in front of your whole abdomen region. And again, hold that for 30 to 60 seconds. Work up to about 3 times of stretching. And do that sort of 3 to 5 times a day if you want, or just once a day, but make sure you do it consistently. Now, other areas you've got to address obviously are to re-strengthen the quadriceps. So I've got a video all about squat variants. Any of those are brilliant for strengthening any of the quadricep muscles and just the legs in general. So I'll link that below, go and check that one out. Other area though that you want to strengthen is going to be your lower back muscles, as they're going to be too stretched and loose as well. So to strengthen those, you can do any sort of variant of exercises that strengthen your back. That can be ones again actually laid on your back, such as bridges. Not everyone's flexible enough to do the full bridge, so just start off with your feet on the floor. Hands can be on your belly or just at your sides, and all you're looking to do is pull your heels in towards your bottom as you push up from your shoulders and actually push the pelvis up towards the ceiling. Now what you want to do with this is actually move as a unit, so make sure that you're bringing your rib cage down to actually contract the abdominal region, and keeping that locked in as you go up and down, so that you're getting a good workout supporting the lower back there. Alternatively, better exercise I think for strengthening the back, as it's more difficult for me personally and I can actually feel this working better. Any form of Superman hold. Lie down on your belly, arms at your sides, and what you want to do is tense your glute muscles, your bottom, to lift your legs up at the same time as curling up like this, and hold this for time, working up to sort of 30 to 60 seconds just for the holds. Then you can make it more difficult by putting your hands out in front of you, or alternatively, if you don't want to do static holds, you can do this for repetitions, really concentrating on tensing these muscles in your lower back, which you should feel straight away. So that's going to address a posture that's got posterior pelvic tilt. Going to teach your muscles to re-lengthen how they should, and that in turn is going to stop pulling on your knee tendons and so help you with your knee pain. Hope this video helps. Hope you enjoy the exercises, and good luck with your training.